Western civilization is moving closer to a point of irreconcilable, unstable equilibrium, as frighteningly increasing numbers of people trust nothing. Media, academia, and especially the governments are no longer held in high esteem. Regaining trust is often impossible after betrayal. However, transparency is essential to any healing process, and that is the essence of the Don Sullivan Show. Please listen to the team explore, probe, and debate cutting-edge science, technology, and computing. Play ball!
Well, hello, everyone. We're back here at the Don Sullivan Show. I'm actually doing this episode from inside my vehicle, inside a parking lot in the mall in Denver, because I didn't get home in time. But this is a very special episode. It's a little bit different than the last episode, I think, that you'll find, but it's of no less importance. We're in the series of overall medicine, and this will be the first episode that we will have done on dentistry and modern dentistry. So I want to again welcome you back to the Don Sullivan Show, the show where we talk about all things science, technology, and computing. And I want everybody to be aware that we're going to have a lot more of these. And so today we'll start off by introducing you to Dr. Elliott and Steve. And Steve is here with me today. He wasn't here last time. So, Steve, why don't you take us away and let's talk?
Absolutely. Well, greetings from the Garden State. Today's episode is brought to you by License Fortress, the industry's first and only software asset management firm to offer both a financial and legal guarantee at its highest level of service. Whether it's Oracle, Microsoft, or VMware, License Fortress helps organizations stay compliant, avoid audits, and save money. Learn more at licensefortress.com. And please support our producer by visiting axtinc.com. That's AXTINK.com. Subscribe to his YouTube channel and help support his efforts to create humorous animation and return all those Christmas gifts he stole from that orphanage. Back to you, Don.
He did that too. I mean, this guy, man, I can't believe we keep him working. I'll tell you. So, Dr. Elliott, please introduce yourself and tell us a little bit about yourself. And I will state to start with that Dr. Elliott and his office has put 3 crowns on my mouth, all of which that work absolutely amazing. I was in a lot of pain, and they are absolutely expertise. And over the last 25 years, they have helped me in every conceivable way at the last minute and strategically with great advice and so on. So, Dr. Elliott, please tell us about yourself.
Yeah, thank you so much for having me, Don. Yeah, so currently reside in Lakewood, Colorado, a little suburb of Denver, and practice nearby. I've been a dentist for about 8 years. Originally went to UMKC School of Dentistry, and have kind of been practicing around the Colorado area ever since. And I've been at my current practice, the one that Don is also a part of, for about the past 5 years. Yeah, it's been great. And thanks again for having me on.
Absolutely. And oh, you know what, Steve? What did I forget? I forgot the waiver. The lawyers are going to kill us. Okay.
You forgot to give the waiver.
I got to do it. All statements by the host and the guests of the Don Sullivan Show are the personal opinions of the host and the guest, all of who agree that the content is the property of Zanalytics LLC to be used publicly and exclusively on the Don Sullivan Show. So everybody's shaking their heads, audience, and Sean and John and the other lawyers are happy with me now since they wrote all of that. All right, so Elliott, let's start all this up. And dental work generally is one of the least pleasant subjects that people want to consider on a day-to-day basis, but it's also one of the most important. Dr. Elliott, we have discussed the state of overall health of Americans before on the Don Sullivan Show. What would you say, from a dental perspective, in your career? What would you say is the general health of American dentistry, the state of American dentistry in terms of the health of Americans, the insurance systems aside? Is it better or is it worse than, say, the last 10 years?
I think you can answer both ways, in all honesty. I think general trends are positive. I think people are becoming more aware of number one, the connections between dental health and the rest of the body. More and more research is coming out every year, and I feel like I've had patients take more of an interest and become more motivated to complete treatment recommended just based on those recommendations. I do think underserved areas can be problematic. Dentistry is tough because it can be expensive, and if you neglect your oral health, it's even more expensive. So it becomes this sort of circular pattern where, unfortunately, a lot of patients that need a lot of work are often in the, least, monetary
They're not in a
situations.
position to really help
When you have
themselves
a
out,
lot of
right?
stuff going on. Exactly. So, I mean, even for instance, going to dental school, I, again, am from Kansas City, Missouri, and went to school there. And there was definitely a big push, like during interviews and such, before even applying for dental school, that they really are trying to find more dentists that want to go rural, because there are, small spots in Missouri which don't have large populations, which are underserved, and they don't have many practitioners in the area. And, many people having to drive for long distances, and that, isn't always a possibility for some families. So that can be tough. And on the dental side of things, it's tough because many dentists don't necessarily want to practice in those locations because the patient base is relatively small. So it's kind of a lose-lose for everybody. It's a tough position to be in. But I do think that, again, overall, I think there's trends. I mean, I think in general, Americans are starting to trend in the right direction and understanding, taking care of their bodies, taking care of their oral health, taking care of their diet, better than they really ever have before. And I do think that we're trending in that direction.
Well, I know in your office you very generously offer a basic plan for people just to come in and get their cleanings and at least put them on some type of plan if they have something severe pop up. Do you see people taking advantage of that? Again, going back to what you just said, that it is the people who are least capable and the most vulnerable who are getting the least care, right?
Yeah, I do think offering the in-house plan has kind of helped us maintain a solid patient base for those who, a lot of, people get dental insurance through their employers and want to take advantage of that. But for those who don't, especially more elderly populations, I think is a good example where they're likely not going to have dental insurance. And unfortunately, there's reasons that, as we age, we're going to run into dental problems. I mean, the longer the human lifespan extends, your teeth aren't necessarily built to last 100 years. But as we live longer and longer, that's becoming the reality. But luckily, we're coming up with new solutions all the time to improve that diagnostic.
Yeah, it's not only your teeth that aren't built for lasting 100 years. Most of the stuff in your body isn't meant to last 60 years, I'm finding out.
Exactly. So that's why more and more dental care is, there's a lot of preventative stuff, but there's a lot of new things for treatment. And I'm lucky to work in an office where there is more of a emphasis on, treating what needs to be treated. A good example would be, sometimes while more expensive treatment might be better for long-term health, at least we'll do, small fillings where a crown might really be necessary just to help that patient out, at least at the very least buy him some time, and hopefully we can get something more permanent on in the future.
Elliott, do you find that a lot of, well, I guess I can't say your patients, I would say people in general, if they're bad about dealing with any health outcomes, obviously that would probably include dentists, going to the dentist. If they're not great about taking care of themselves or getting help or getting preventative care. But is there something particular about going to the dentist where people are worse at that, have more of an aversion or lack of, motivation?
Yeah. I mean, dental anxiety is a constant thing in anyone's practice. I think there's a lot of patients who just feel anxiety going to the dentist. I think that's for a number of reasons. Many older patients had, bad experiences when they were younger. I hear story time after time of, older dentists, working on kids and saying, you don't need any anesthetic for this. You'll be fine. We'll just do it without anything. And going through a painful experience is kind of hard to come back from, because then you have those kind of negative connotations every time you do go to the dentist. I think another thing is kind of I do think one thing that could be improved is a lot of patients still have the opinion that if they're not having pain, everything is all right. There's nothing going on. And that's a very common misconception where it's tough because, in all honesty, if you maintain going to the dentist pretty regularly, I mean, we recommend once every 6 months for, a basic cleaning and exam. And I always tell patients, even if you can come in once a year, twice, or once every other year, at the very least, we can at least stay on top of it enough. These patients that come in and haven't been to the dentist in 7-8 years, that's where we kind of run into problems, because they come in and have all this stuff going on, and then I think it just leads to being overwhelmed with this complex treatment plan. And, let's be honest, it can be pretty expensive. And I think that kind of scares patients off. But the patients that do come in regularly, I think, truly are much better off. And in the long run, although it might seem pricey, it really does save a ton of money in the long run, which I know is a big, big concern for a lot of people.
I think sometimes people tend to view going to the dentist as, well, that's just the health of your teeth and your gums. But correct me if I'm wrong, the plaque that's on your teeth, that's also the stuff that goes through your arteries, and there's a connection there, isn't there?
Absolutely. Yeah. And that was kind of one thing I kind of touched on earlier, is we're finding more and more connections between oral health and overall body health. A great example, like you said, is that plaque buildup. So plaque is kind of the byproduct of bacteria in your mouth, and everyone's going to get plaque. Everyone has bacteria in their mouth, and that's normal and fine. The problem is if it gets to kind of a greater load and you get more and more plaque, any sort of, basically, it enters the bloodstream and it can travel to other areas of the body, causing things like heart disease and early onset Alzheimer's and liver cirrhosis and a bunch of other things, where the body sees this chronic inflammation and they read it all over the body. And then the body tends to want to almost overreact and overtreat that, because it's trying to manage this intense bacterial load from the mouth. And it kind of will affect other things, like I was mentioning.
Is there a cure for plaque, or what is the cure for plaque, if there is one?
That's a good question. There's not a true cure for plaque. Again, you're always going to have that bacteria in your mouth, and that's why we kind of recommend regular brushing, regular flossing, of course, and coming to see your dentist every once in a while. Diet, diets most everywhere, but American diets especially are very carb heavy, and starches, sugars. That's what bacteria in the mouth feed on. That's how they grow and propagate. And the more of that you consume, the more your bacterial load's going to be, and that's the more plaque you're going to get. So again, changes in diet and being aware of that. Like for example, I think one thing that I like to talk with all my patients about is diet. Like, for a good example that I tell almost every patient I ever see, some have heard it, some have not, is it's really not necessarily about the amount of the stuff you consume. It's about the amount of time spent consuming it. So I always give the example of like a can of Coca-Cola. We know it's sugar. We know it's not great for your teeth. But a lot of, especially kids these days, energy drinks have gotten very, very popular. And they are extremely sugary, extremely acidic. And the problem is, we find that a lot of patients will sip on those all day long. So again, my example of Coca-Cola, if you're constantly taking a sip every, let's say, 10 minutes for a couple of hours, and you're just slowly sipping on this thing, you're constantly coating your teeth. You're constantly feeding these bacteria, and your natural saliva can't really rinse it off. It can't deal with it quick enough. So that's one thing I always advise is, if you're going to consume these sugars, these starches, try to do it like at mealtime. Try to keep it in shorter time periods, because that alone can make a huge, huge difference. Especially,
sugar is the enemy.
Sugar absolutely is the enemy.
They always said that when we were kids. You're going to rot your teeth with that.
Exactly.
Sugar's the enemy.
Yeah, it seems like it.
Yeah, exactly. But I always give the example too of, fruit. Fruit is healthy. We know we like to consume some of it, but it still is sugar. So snacking on, strawberries. Well, we sometimes think of that as healthy. It's really not great for your teeth. I'm not saying, you should never eat fruit again, but snacking on it all day, every day is not good.
Understood. To get us onto a different subject, why don't we talk about dental history?
Yeah.
Don, what are your thoughts on that?
Well, it's such an interesting subject. Most famously, I think, or certainly historically, we know that from forensic dental analysis that King Tut, the boy king, likely died of an abscess. And Hollywood certainly depicts 18th or 19th century dentistry on a par with medieval torture. Figures like Doc Holliday, for example, being a dentist. It's kind of a silly question, but what about comparing modern dentistry to that kind of technology?
Yeah, it's a good question. There have been obviously many strides made towards, painless dentistry has been a very hot topic for a long time. They're constantly coming up with new anesthetics for different reasons. One that I mainly use in my office is what's called Septicaine. So we all know the name like Novocaine or Lidocaine, and those were more early renditions of kind of the same thing. But these new anesthetics just tend to be a lot more potent and more make the experience more comfortable for patients. As far as like technology differences between the two, I will say one thing that, older dentists, 50s, 60s, is gold. Gold was in abundance. It was much, much more affordable and was used in almost all of dentistry for a very long time. And to be completely honest, it can't really be replaced today, even with our modern materials. Obviously, we've made strides in making more natural looking teeth. We can use white filling materials and white crowns that blend in with a natural dentition. But I had a patient in my office. Well, it's been like 10 years ago now, but he had a crown placed in the fields of World War II by a field dentist. And
Wow.
he had a bunch of gold restorations and gold crowns. 65, I think he said, years old, and they were all still doing great. Even with modern materials, it's really hard to beat that. I would say, though, like benefits made is we're much more aware of how to deal, and preventative care has become much greater. The introduction of fluoride is a huge one. I think it's a great example for it's really reduced the amount of cavities and such. But we eat so much processed food nowadays that contains so much of these starches and sugars, it kind of balances each other out. Other kind of technological strides, I guess, are the production of dentistry is becoming more indirect. What I mean by that, crowns, fillings, you can more and more these days, we're taking impressions or taking these scans or images of the mouth and using those to mill these restorations. 3D printers are becoming much, much more common and is kind of like the next big thing in dentistry. The faster they can make them run, the faster they can produce these, the less time patients have to sit in the chair, and becomes just an overall better experience for them. I think, Don, and you remember we used one of the scanners in your mouth. We kind of take those images. These scanners take about 25,000 images per second, and they condense them to these tiny files. And we can use these, number one, to, you enlarge it to 50x. So it's much, much more detail. So you can kind of pick and choose on how you want to shape the crown or the filling, and does create better fitting, what we call margins, which is where the edge of the restoration fits up against the natural tooth structure. And that more strong fit, that more tight fit, that's kind of a really big reason that dental treatment will last longer and longer.
You're basically making like a digital twin, it seems like, of someone's mouth.
Absolutely.
Through the pictures. And the last time I was at the dentist, I had to get a tooth drilled and then they filled it in. But yeah, beforehand, they took x-rays, and before that, they scanned it all around. They had a tool that I guess they kind of move all around in your mouth that's kind of creating a 3D image of it, it seems like.
Exactly. Yep.
Yeah. It really is fascinating.
And it's cool. It's good. And same with, we have these tiny cameras where we can take pictures in your mouth. It's also very good for informing patients because I can kind of show and tell. I'm a big fan of showing patients their x-rays. I like to point out the cavities that you can visually see what I'm talking about. I think it makes it much more impactful, and kind of drives the need to know that you do need that treatment. And just diagnostic tools in general. A good other example is more and more dental offices are having CBCTs or cone beams installed.
Guys, I think I've watched
which is basically a whole 3D image inside the mouth. So it's much easier to discover cracks and abscesses that might not be visible on traditional 2D x-rays. So while most dentists are still just taking 2D x-rays for like preventative reasons to check for these sort of things, if there's something that, a patient's in pain, but we can't figure it out, or it's a particularly difficult root, everyone's tooth anatomy is a little bit different. And For example, some roots, most patients' roots, you'll have like 3 roots in your upper molars, but they can have 4 or 5. I've even seen up to like 6 canals. So if you need a root canal, we need to know that you have those 6 canals. And back in the day, without these cone beams, it was impossible. I mean, you just can't see
Kind of
with
a
that
guessing
definition.
game to an
Exactly.
extent. We'll see.
And with experience,
yeah.
you can kind of see these things. But nowadays, you can just take a cone beam and you know exactly what you're working with and what needs to be done. So it makes it a lot easier to kind of treatment plan effectively.
And those roots can go incredibly deep. I was telling you before the show, I got 2 wisdom teeth out recently, and it's amazing the holes that they leave when they take those out. It's something. So moving on to another area that I've heard before is, correct me if I'm wrong, but aside from genetics and industries, most dental health issues are caused by 2 problems: lack of regular care, and then we talked about sugar. Is there anything else you see as a dentist that leads to issues?
Yeah, good question. I do think another big thing that we're becoming more and more aware of is airway issues is a great topic.
Airway.
A lot of patients that have airway stuff.
Yeah, okay.
Patients with like sleep apnea, for example, and there's many reasons for this, and I won't go into all the different causes for airway obstruction, but
somebody told me that just means you have like a fat throat. I don't know if that's true at all.
Honestly, a fat tongue might be a better description.
Okay,
your tongue,
interesting.
if you didn't realize, is this very large muscle that extends very deep into your throat. And some patients have these larger tongues, and especially, overweight, obviously is a common one, but they're finding, for instance, if you weren't breastfed as a child, they're finding that your airway tends to be more closed and tends to lead more issues. But
because you weren't sucking and I guess using the muscles that open it up or something.
Exactly
really?
Right. Huh. And they tend to have lower hanging palates, so they just don't have as big of a mouth, I guess is the best way to say it, as big of an airway. And these can lead to these breathing problems. I find can really lead to a lot more issues than patients realize. Obviously, it's you want a good breathing capacity for other reasons, but in terms of dentistry, a lot of patients grind their teeth, what we call parafunction, where basically if your teeth aren't aligned properly, or if you have airway issues, we tend to grind and clench. And I think there's a lot to do with, we all consume caffeine. We're all anxious and stressed. So
I do that. They want me to wear one of those. Well, I have it. I don't always wear it. I'll confess.
Appreciate your honesty.
But that little thing you kind of,
it's
like
guard?
A retainer. That's what it is. A night guard. It looks like.
Steve,
it reminds me of a retainer.
You've recommended. In fact, I have a retainer. I'm not saying I use it enough, but I had no understanding whatsoever that I was grinding my teeth at night. Nobody ever told me that. But apparently you were right.
Only your dentist knows. Yeah, it's amazing. They'll look at it and be like, that you can't hide it from the dentist. They'll figure it out.
And that's a more common thing that I think I personally recommend is I do prescribe a lot of night guards. I think it's a very beneficial thing that many can benefit from. Again, just with our daily habits and such, a lot of patients grind their teeth at night. And again, there's other reasons for grinding. Some, you're sitting in traffic and you're anxious and that sort of thing. But the wear patterns on our teeth can definitely take a toll. Another good example would be like overbrushing, actually, or doing too much. A lot of patients that have otherwise good dental health will use like hard bristled toothbrush, was where we usually recommend a soft or an electric toothbrush. And they'll brush so hard that they'll wear away their gum tissue and cause what we call abfractions, which is basically sort of a loss of tooth structure right at the bone level. And those create little spaces where food can compact and cause cavities and other issues and just cause weakening of the tooth structure in general.
Interesting. That really is fascinating.
I got a different line of question. This is something that has bothered me for a while, just to a certain extent from a societal or political perspective. Plaque that's on our teeth it's calcification and other things, I guess. But it's essentially the same as the plaque that's in your arteries, my arteries in particular. How I've also heard that I've read that there are different bacteria that consume plaque. Now, of course, we don't really know what else they consume, which is a problem. But I guess the real question is, are we close to a point of solving the overall plaque issue? And the reason I ask that is the cynic in me says, these are $2 trillion industries. Is it in the best interest of the pharmaceutical companies to actually want to solve this problem? But really, from you, do you think we're close to solving the problem of plaque in general?
Well, and so that's a tough question because the problem is we have these bacteria in our mouth that cause plaques, but you also kind of need that bacteria. It's the same type of bacteria that is held in our guts. And it's a symbiotic relationship that's easy to push out of whack, to push out of balance. Strep mutans is the biggest, usually, bacteria that causes cavities. So I have, and it's not something, to be completely honest, that we really implement in my office. I know that of certain offices that are testing for these bacteria, seeing what is imbalanced, and they'll come up with kind of ways to try to take out the bad bacteria, grow the good stuff. That being said, we're always going to still have plaque. We're always going to have these issues, especially with our diets today consisting of so many foods that kind of act as substrate for the bacteria.
Yeah, so
that
we can blame the food industry. I'm very fond of doing that. Yeah, go.
And that's honestly one of the biggest things is diet, and diet alone is the biggest reason for dental caries or cavities.
Well, okay. Since you brought that up, what are the best things that you can eat that are actually things you should eat in general every day that you would recommend? I mean, I thought for decades bananas were one of the best things in the world until I started actually taking my blood sugar tests, and I found out they're the worst things in the world for me. So, what do you think are the best things from a dental health perspective?
Red Bull and cigarettes, Don. I'm sorry. I'll let you go, Dr. Elliott.
Yeah, 9 out of 10 dentists would agree with you, I believe, Steve.
Yeah, there you go.
I mean, anything that's carbohydrate free is kind of the biggest. Anything that doesn't contain these simple sugars or starches, proteins, vegetables, things high in fiber, nuts. Obviously, we know that calcium is a big one. So, making sure we get enough calcium in our diets, whether that should be through milk is a common one, or
okay.
Other
So
things,
let me stop you there, though.
kind of the biggest reasons.
I was having some bone density problems, and so I was told by the orthopedist to take calcium supplements, and then all of a sudden, a year later, I've got kidney stones in both of my kidneys. They say, "What? Stop taking those damn calcium supplements."
The road to hell, Don. It's paved in good intentions.
Yeah, you're absolutely right. It's such a balance, and that's kind of the main issue is we're always, something needs something, and it can be too much for another part of your body. So you're absolutely right that you can overindulge in any of those things. And
I wasn't overindulging in calcium supplements. I was taking one a day, but apparently it said stop all dairy.
Cause the kidney stones.
Yeah. Well, fortunately, one of them emerged.
Does pizza count as a dairy?
We allow pizza, yeah. Throw some veggies on there and we'll call it good.
Yeah, if you a vegetable pizza, Don, instead of those calcium chews, there you go. You got a nice little meal there.
So I have an interesting conundrum with this as well. I've got two people in my family, my father in particular, and then my younger brother, who have incredible problems with their mouth. And I have been, you obviously and your office over 25 years have been incredibly diligent and helpful with me on this. But for the most part, I'm pretty good. And my younger brother's 3 years younger than me, and he's got teeth like my father. They're all falling out. And he's going to have tremendous amounts of work done, probably the total replacement option. But my father is 92, and he's been stubborn as all hell and everything. And he has chosen not to go that route. It's still terrible. So, genetics are clearly a factor, but they don't seem to play the same way out, and everybody do that.
No, absolutely right. I mean, that's kind of the hard part about anything in healthcare is, for some reason, certain patients' bodies just react differently to certain types of treatment. It's not as predictable, and dentistry is a good example in terms of, depending on what provider you see, might recommend completely different types of treatment based on their experiences and based on the general patient base that they see. So genetics play a part, but I do think that it can be a little bit overstated. I do have a fair amount of patients that just want to blame it on genetic, and it's like, well, we haven't seen you in 6 years. Something tells me there's more going on here.
Oops,
It's easier to point the finger at genetics.
It absolutely is.
that was
I'm not
just
saying it
last
doesn't play a
month.
part.
Yeah.
Yeah. I mean, a good example of genetics is, I can look at x-rays and see how thick your enamel is. And the thicker your enamel, which is sort of the outer armor for your tooth, as I put it, covers what's called the dentin, which is the inner portion of your tooth. And once the cavity has to kind of make its way through that enamel, through that armor, and enter that dentin before it needs treatment. While it's still located in the enamel, and if your enamel is thicker, that means you kind of you're buying yourself more time, right? That's the other big reason that fluoride is so popular and so common these days, is because it helps remineralize that enamel, it's this crystal structure where you have these hydroxyapatite crystals, and the fluoride ion takes place in one of those. It helps strengthen the tooth naturally. That's why we're so big on fluoride these days, which I know is another kind of touchy topic out there today.
You're not going to get away with circumventing that. Since you brought it up twice now, how do you feel about the fluoride controversy in the water?
Yeah, I mean, I understand it. I do think I've always encouraged, I think people should think for themselves. I don't think you should necessarily, follow the herd. I think it's good to be aware of why we recommend these things. Fluoride is tough because there is, a lot of the claims are that it's poison. A good reason for that is we found that it can accumulate to pretty high levels in what's called your pineal gland in your brain, which affect things like your circadian rhythm. And there's studies out there that
I thought that was just. This is fascinating because I read something like that on the internet, but it was more in kind of a. Yeah,
and that's kind of the problem. The problem is that
conspiracy theory.
It's not a total conspiracy theory, but it's overblown. My argument for patients who are a little bit more anti-fluoride is, sure, I do agree, and there are studies that show this stuff, but it hasn't really proven to be too negative. We are very aware that anything in your body in too great of concentrations is bad for it. A good example is your calcium causing those kidney stones. An overabundance of fluoride can cause similar issues. Whereas what we're wanting is the exact right amount, which is, of course, hard to achieve, but that's why it's such low concentrations in the drinking water. I know that there's a lot of push to ban that sort of thing, and I can understand the thought process is, you shouldn't be able to force something into my body in something like drinking water. The problem is we found such a reduction in cavities over the years due to this fluoride in the drinking water and in your toothpaste. So my opinion is that if you follow the instructions we give you of, drinking the normal tap water and using a fluoride toothpaste, but not swallowing it, we want you to spit it out, and we don't want you to use very much of it. A lot of patients use far too much toothpaste, and they're getting way too much fluoride.
So like limits. The little, this is interesting because my grandkids, the 3 and the 6-year-old, the toothpaste is made for them to really like it. So it's like candy, and they want more and more and more. We shouldn't do that, should we?
Like the bubblegum flavor.
Exactly.
Yeah.
And a lot of those, we advise using a child toothpaste because they have far lower fluoride content. And if you're too young, like babies, you don't really want to use much fluoride, if any at all, because they're just going to swallow it, which we don't want.
That's interesting.
But it's good to be aware of it. And, I watch the studies pretty closely because it's a very, very common question in my practice. We live in Colorado. There's a lot of free thinkers around. But a few too many dive deeper into the conspiracy theories where do I think it's a government conspiracy to control your minds? Yeah. I don't quite buy that.
Oh,
you're a very
proactive.
You're a very proactive provider, so I see you doing exactly that. So it's
exactly. Well, and again, it's just we found so many connections between your body. My argument is, we might have some negative consequences for fluoride, but if you're very cavity prone, you're constantly introducing all these little micro infections into your body, which, number one, obviously you don't want to have to deal with teeth-wise, but also because it affects negative health in your body entirely. I just think those proven benefits that we found from fluoride far outweigh the possibility of negative effects from that same fluoride.
So what's happening in modern dentistry that excites you personally as this proactive, very thoughtful dental provider?
Yeah, good question. I think one great thing about dentistry, especially compared to other medicine, is as a general dentist, I can kind of pick and choose what procedures I want to pursue. I can look into new technology and new types of procedures that are out there and pick and choose of what I think would be the best results for my patients. And it's so much easier now. I mean, I'd be lying if I didn't say I've looked up YouTube videos for procedures that I'm not very competent at and truly feel like I've improved because of those. CE, continuing education courses, are easily accessible. There's a million websites you can go to, watch free videos and better your skills. As far as specific procedures go, I think 3D printers are probably one of the next big thing in dentistry. We were kind of discussing this earlier, Steve and I, but they're becoming much more common, and I do think it's the next big wave in dentistry of, number one, just providing quicker treatment and more effective treatment for patients, because you can sit in the chair, I can go back to my 3D printer and just print this crown out in 30 minutes. It doesn't take very long. They're really increasing the proficiency of these machines and coming up with new polymers and stuff that they can print that are dental based. Obviously, the wave of 3D printers have been in everything from commercial grade to consumer, little projects and stuff, but there's been more and more interest in coming up with new materials that are compatible with these 3D printers that can be used in the mouth. I think that's pretty fascinating. A big one that I get asked is, I see a lot of articles about regrowing teeth, which is a fascinating technology, and maybe one day will become a thing. Yeah, exactly. But I will say, I think that technology is a long way off. And one other thing I always tell my patients is, well, you realize you're going to have to wait for it to grow, right? Like, they can plant it in you, but it'll take about 6 years before you have a new tooth. So most patients
just have like a baby, a little baby tooth for a while.
Kind of true, yeah. But it's still a fascinating topic to kind of follow, and maybe 10, 20 years from now, it'll be something that's more realistic.
What I was going to ask you. What do you see happening over the next 10 to 20 years? It's really exciting. We love to end the Don Sullivan Show episode on a positive note. So what do you see happening in 20 years?
In 20 years. I think, number one, I think Americans in general are becoming much more aware of their diets. And I do think we're going to see a reduction in just oral health care. I think people are more motivated to take care of themselves and more motivated to hopefully be proactive and preventative for these same issues. I think a big one is total, you brought up like total tooth replacement, or it used to be, if you lost all your teeth, the only option was a traditional denture, right? We all have seen our grandparents and stuff with these things. It's a big piece of plastic that you take in, you take out, and they're a pain to use.
You tape them in, right?
Exactly. You got to make it somehow stick to the roof of your mouth.
You have the good grip, so it doesn't come off when you bite an apple. The commercial always had him biting an apple to show you the goods.
And the truth is, I always tell patients, it's a piece of plastic you got to somehow learn to make use of as teeth. It's not comfortable. They're not fun.
What about the wooden teeth? We kind of got away from.
We don't use much of those anymore. I haven't had any requests for those in a while.
That was George Washington, right, Don?
George Washington's are heirlooms. That's right. They're in the museum. There's wooden teeth.
Amongst others. Why did they do that? To put us on a totally different tangent.
Didn't have any better materials at the time, I believe.
We'll make these teeth for you out of wood.
Exactly.
So how did they put them in, though? Like, they just shoved them in the holes that used to have teeth in them?
It is pretty impressive. I mean, if you ever look into it, it's impressive what they were able to do for their time. I don't think that anyone wants that kind of thing now, but for what they had to work for,
what about pain management? Did they just get drunk or something?
Yeah,
like
whiskey.
Yes, whiskey. Okay, whiskey and wood. That was
whiskey and wood. That was the.
So now we know why George Washington had such a problem with the whiskey rebellion. Okay, now we're putting it all together.
Exactly right.
Yeah,
it's all making sense.
Listen, Dr. Elliott, we just thank you so much for joining us. If you aren't sick of us right now, I will certainly be in the next month for us to have our final annual visit. I'll see you as a patient then, but if you're not sick of the Don Sullivan Show, maybe in 6 months or a year, we'll have you back on to give us an update. I'd love to have you.
Yeah, I'd love that.
Wonderful. And again, we thank you a lot. And Steve, you want to take us out, and then I'll end.
Absolutely. No, thank you so much for coming, Dr. Elliott, and see everyone soon again.
All right. Thank you guys so much.
I will say again to the audience, no matter what you're doing, whether or not you're climbing up the highest mountains in Colorado or to the deepest canyons in Arizona or in the Colombian jungle, or if you're flossing your teeth, it doesn't matter, folks. Remember this one thing, that all at-bats are situational.